We're back. We're back. Welcome back to the Black Psychologist Podcast, episode 18. We are moving right along. Appreciate everybody being here. Again, you could be anywhere in the world, but you're here watching and listening to us. I am one half of your humble and gracious host and clinician here for your listening pleasures, psychologist Dr. Kyle Osborne. And of course, I'm never, ever here by myself. I'm here with he's the J to the Izzo, V to the Izzy, for she not easy. His arms is so breezy. Can't leave health alone. The game needs me. Haters want to know how he does it. It ain't easy. My guy,
Yeah, what's going on?
Dr. Jason Coleman. How are you, good brother?
Man, I'm good. I can't complain, bro. Week is almost over. It's been productive. So the boat keeps moving, man.
Absolutely, absolutely. We're moving on. Tomorrow's a holiday. We're going to be observing the holiday depending on where you're at. But Juneteenth is coming up the next couple of days, tomorrow and Saturday. So we'll be celebrating that. So happy Juneteenth Day to you, good brother.
Happy Juneteenth Day to you, my brother. That's the first
Like,
time I really said that, man.
yeah,
It's
yeah,
gonna be the
feel
first
good,
of
right?
many times, though.
Yeah, feel good. We got to get used to saying it. Feel good.
Yeah. Listen. I actually think that the whole movement, like we all kind of saw last year, with people celebrating it. I know some people, a small amount of people, probably been celebrating it for a longer period of time, though. But I actually really think that's pride manifesting itself. You know what I mean? That was kind of like, to me, like, I mean, I'm not saying that major corporations and stuff aren't pushing it now, but in terms of what it means to us, it started out as a grassroots kind of thing, from the community. So, like, I'm looking forward to celebrating it, and I'm hoping, like, moving forward, it's like barbecues and big type of celebrations with appreciation of the history.
Absolutely. Well, they just made it. They just passed it. It's gonna be a
Federal.
federal holiday. So yeah,
Right.
we're gonna be all for it as well. We should, and so we can observe it the right way.
Right.
And yeah, we're moving right along. So it's long overdue, but here we are. So we can
Yeah.
continue to make that progress. All
That's a
right, so
fact.
we're gonna do things a little different. As we've been talking in the previous episodes, we've been wanting our listeners and watchers to reach out through email so we can make the conversation more interactive. And we have a couple people that reached out to us on via email at the Black Psychologist Podcast at gmail.com. So what we're going to do, we're going to pull up one of the videos and I'm going to read the other email. So we appreciate you guys starting to throw in and starting to write to us because we appreciate the conversation. All right. So let me pull this first one up and we're going to get into it. All right, here we go.
Hi, so my question is, do you think there is a such thing as a good fit when it comes to seeking out a therapist for mental health services? Hi, so my question is, do you think there...
All right. Jay, what do you think about that? I had to remix it. I was going to put a different on it the second time, but I don't want to show off. So
Yeah, we're gonna have to fire the tech guy, man. You know what I mean? I'm firing the tech guy after
hey
this
man,
episode.
budget cuts. We get what we can get.
No, I think that's an excellent question. To be honest, that's a question I've gotten before, right? Absolutely, right? And one thing I kind of I'm in this role talking to parents a lot. And one thing I tell parents, about their kids and about their rapport for the therapist is comfort is important, right? If the patient isn't if the patient isn't comfortable, if the patient doesn't feel like the therapist understands them, then the treatment or the session is really irrelevant because the person isn't going to open up, right? They're going to be guarded, and you're not going to really have that environment where change can happen. So I think that's very important, and I think patients have to be empowered, right? I think sometimes when a patient feels like they have to stick with the first therapist that they're assigned to, I think that's where we fall short sometimes, right? Because it is our job to make our patients comfortable enough. Whereas if I'm seeing a young girl who's 8, 9 years old, and she's getting a little older, and she would rather talk to like a woman about certain issues and would be more comfortable, I got to make my client comfortable enough and offer them the opportunity where they can say, listen, Dr. J, I love you, but this is what will help me most now, right? And when we get those type of kind of questions from our clients, it's not our job to convince them to stay, right? It's our job to make sure that we find somebody that's the best fit, right? So I think that's a good question, and I think it kind of fits right along with how we need to empower, the patients in terms of what they have the right to ask for, right?
Absolutely, I agree 100% with everything you said. What I'll add to it is that, first and foremost, is therapy is it's a vulnerable situation or relationship that someone's going to be in, right? You're going to
Right.
be divulging information and talking about things that, you struggle with, right? It could be trauma. It can be things that are contributing to your stress, your anxiety, all these other different things. And just like you mentioned, you want to be comfortable. Like that is like step number one of when someone comes into your office and they want to see, okay, how am I vibing with this person, to kind of, to put it in a more general term. Am I going to be able to be comfortable? You know, the conversation is going to be, hey, how am I, how do we fit? Like she just mentioned. And if you don't fit or you're not getting a comfortable vibe with this individual, then absolutely, there's no way that this person's going to want to divulge any type of personal information to you. And therapy is a collaborative relationship, right? You're on this journey together. And if there's any type of barrier, it's going to start with, okay, I don't feel comfortable with this person due to a variety of different reasons. So
Right.
nothing's going to go forward with this relationship if you don't feel comfortable with this person. And so I've told people in the past that, when you are going through and trying to say this therapist or this counselor or whoever, yeah, feel free to ask those questions. And you also shouldn't feel like you need to ask it in the right way. Just be open, be honest, right? This is a non-judgment zone. It's a judgment-free zone. So you want to be able to ask these questions and kind of say, okay, is this person going to be fit for me? Because that's where it all starts. So absolutely, you definitely want to have that fit and be comfortable with the person that's going to be sitting in front of you in order for any type of growth or any type of progress to happen. So totally, it's very important, and I'm happy that she asked that question.
Yeah, definitely. And just to kind of cap that off, I think we as service providers, right, we got to remember that therapy is voluntary, and that there's automatically, a power differential, as soon as our patient walks in the room, right? So it's our job to kind of empower them to ask for things like this, right? Even if it puts us out of a job, essentially, in terms of that particular patient, right? Because the goal is supposed to be positive outcome. So, I mean, I know I've referred patients for a variety of reasons, to different therapists. And you got to get over yourself because it's not about ego. It's not about you getting the disclosure of the information or, whatever. It's about the person getting better. So, um, yeah, I think it was a great question.
Absolutely. So we appreciate that question and sending it out. All right, on to our second question. All right, so this is from Ingrid. I'm just going to leave it at that. All right. So Ingrid would like to know the reason for my email is because I would like to, if you can touch on the topic of how we can cope with grief. It's very unfortunate, but young or old, we will all have to deal with this enemy called death and deal with the notion it leaves behind as far as sadness. And this sadness in due time can lead to depression. Unfortunately, we can no longer pick up the phone and call our friends and our loved one. If you can please touch on this topic, I would really appreciate it. Thank you in advance. And I just want to throw this little caveat out there also. She loves how you are introduced into the podcast. All right. So I may have mentioned something about you being a diva and you kind of demanding it go that way, but so so yeah. So what is your thoughts about how we can cope with grief, and especially, given the times and climate that we're currently in?
Well, I'm gonna take this in two different ways, right? One thing I think we got to say is, like, people obviously cope in different ways, right? So the first thing we got to say is we want to kind of stay away from, the methods of coping that we would call maladaptive, right? So we're talking about like excessive like substance use or just behaviors that could damage you, in the long term. But I, people cope in different ways. In this time, what I like to emphasize with a lot of individuals is the social support aspect, right? And we got to use technology. Although we are separated, technology kind of allows us, to kind of be connected sometimes in ways, that we couldn't usually do, right? So we have to get creative, right? When you lose somebody, it's never going to be easy, right? And these days, I think we have to recognize how hard it is because you have people who at some points during this pandemic weren't able to go to the funerals of their loved ones, right? So the one thing we have to recognize is that it's not going to be a normal grieving process right now, right? Everything has been on hold, right? So unfortunately, like some of the normal channels that we have in terms of getting together with our family members, crying together, having those memories together, we just don't have them, right? So things that are as simple as these commercials you see, where you have 25 family members on a Zoom call, those are kind of some of the things that we have now to make us, kind of feel more supported. And I think we have to understand also that therapy services in terms of therapeutic support, if we get overwhelmed, are probably more accessible now, right? Because almost everybody is doing teletherapy.
Mhm.
So, this is the time that we have to kind of reach out for support, kind of past our loved ones if it gets, to that point and we get that overwhelmed and reach out for that, professional support. Other than that, just good coping skills, right? And I'm always emphasize to try something new, right? Whether it's mindfulness technique, whether it's diaphragmatic breathing, grounding, different things to focus you, in the present moment or kind of get you through the day at work or get you through some of those difficult moments, exercise and physical activity, a bunch of things. But we got to use kind of what we have. What do you think?
Absolutely. Grief is significantly different since 2020, 2021 due to COVID. It's compounded by all of these other different factors um, that have been occurring around it. So you have COVID, right? So you may have some people that are unfortunately passing away due to complications from COVID, and then you have individuals that have passed away for from other reasons. And so
Right.
COVID is that most salient thing where, okay, yeah, you're not able to, like you mentioned, practice those normal morning rituals. So you're not able to attend a service. You're not able to maybe physically be with other people and do all those personal interactions. And so now it's not just regular grief, it's complicated grief. That's what
Right.
it's manifested into. And so now when you have complicated grief, it your symptoms are exacerbated, right? The sadness, the guilt, all these other different things that people experience. And then we also have to keep in mind, like you mentioned and alluded to earlier, is that grief is individualized. So
Right.
everybody grieves differently depending on how the person passed away, your relationship with the person, and so many other different considering factors. So I totally agree with you in that being flexible and being creative are one of those things, especially during this time. Even as restrictions are starting to, um, you know, come about, it's still our form is normalcy is going to be different than when it was prior to COVID. And so I think it's also kind of practicing that acceptance approach, right? So it's being able to see and attempting to how and focus on how can you honor some of these rituals and these things that are important, albeit in a different manner than it was prior to COVID. So, like you said, if it's a virtual situation, being flexible or being creative with the technology as far as reaching out to communication. Journaling has been something. So, you know how people are able to write sincere things, or maybe before you were able to speak at someone's service. So you were able to speak at the funeral, or you may not be able to do that because of the limitations or restrictions as far as in person. So maybe journaling, right? Or even going on social media and writing a post, right? Expressing, how you feel. I think that's something we definitely have to continue to highlight and encourage people that you continue to express how you're feeling for that individual that's passed on. If that's the way that you would like to honor that person, that's something you want to continue to do it. Again, it's just in a different manner. So you do have to be creative, like you mentioned, and we have to incorporate some flexibility in how we're coping. Whether it's also, creating or going through virtual supports, right? There are support groups. So in addition to individual support, individual counseling, I always highly recommend that people find a support group. So you're around other people that are also understanding and have the empathy and that you're going through that grieving process. It's different for everybody, but there's also that common theme, and you want to be able to gain a sense of community. So, like you said, being creative and being flexible with the communicating aspect, because that community aspect is so crucial when you're
Right.
grieving. And then also journaling, like you mentioned, the meditation. Creating a post maybe on Facebook or on IG if you're comfortable doing something like that. Of course, it's different for each person. Um, and being aware of some of those things that creep up to us, right? The guilt, the self-blame that a lot of people tend to experience, especially during this time, because that what if question always pops in also, right? You have that guilt that comes along. So just kind of being aware and having compassion for yourself, because I think a lot of people, when they go through those things, they're not being passionate. I mean, they're not showing that same compassion for themselves and being patient as you go through the grieving process, because you don't know how long the grieving process is going to be for each person. It's really individualized. So, but I echo everything you said, and absolutely being flexible and creative in a manner of and trying to honor the person since those rituals were interrupted.
I mean, just in terms of general advice, I just to piggyback on what you said, I think you had a lot of great points. You want to focus like on general on emotional expression. So whether that's verbally, whether that's reaching out to somebody you trust, reaching out to like your pastor, clergy, a
Mhm.
trusted coworker, whether that's writing, journaling, tweeting if it's appropriate, using technology, right? Making a video or whatever, that could be prayer, emotional expression, right?
Right.
Emotional support is the second thing that you want to do. Create that around you, right? Either that's virtually, again, through your church community or through your regular community of people, friends that are around you. You want to create that support, right? We have through technology, we have ways that we can kind of connect with people, that we couldn't do before. But was to me, I think what a lot of people find useful is memorializing a person, and I think
Nice.
there are a lot of creative ways, for you to memorialize somebody, especially now, non-traditionally, whether that's making a video, whether that's writing a poem, whether that's getting together, like I said, with those 30 people on a video call and reminiscing about those stories and all of those things. But you just got to get creative. And it's unfortunate. Um, but again, there are ways that we can kind of try to insulate ourselves from some of those effects.
Absolutely. So yeah, thank you for sending that question out, Ingrid. We appreciate it. So to everyone else, please continue to send in questions. Dr. J and I love answering these questions, and the same question that you may want, other people may also have also. So absolutely continue to send those through to the Black Psychologist Podcast at gmail.com. All right, so staying with COVID, because it's the most salient thing that we have that's going on in our environment and in our society. So the COVID vaccine, Dr. J, has been here for a few months, right? It was the moment that a lot of people were waiting for. Somehow this vaccine, a lot of people were hoping would be able to, get our lives back to normal, or at least this year's version of normal. However, as we are aware of, um, there have been a lot of reasons why some people haven't gotten the vaccine. And we've talked about it in the past. There's it could be due to the historical mistrust of government or medicine. We've talked extensively about that. It could be people are concerned about the potential side effects. Um, there's also a lot of misinformation about the vaccine that's also making people hesitant to participating in it. One thing that we haven't mentioned is that it could be um, a fear of needles, trypanophobia, the fear of needles. is a contributing factor. And in fact, over half adults of unvaccinated COVID-19 fear needles. So, what are your thoughts about that?
Listen, I thought this was a interesting article because I have honestly never thought about this before, about being like a contributing factor.
Mhm.
They said 25% of, I think it's adults in the United States are averse to needles, 10% of adults and 25% of children. I mean, again, I I think this is something that's not talked about enough,
Right.
you know? Um, because immediately when I started reading this, like it made sense because it brought me back to like the pediatrician's office. You know what I mean?
Mhm.
And it's like, if I endure this pain for 2 seconds, I'm gonna get a lollipop, like that type of stuff, you know? Um, so I don't know. What I thought was interesting, like when they started talking about like the methods, um, you know, I some of the one I kind of thought was most interesting was and most effective was the distraction, you know.
Yeah.
Um, Especially nowadays with Instagram, with games, people on their phone. I'm thinking that that's probably would be the most effective way to get somebody to kind of take the vaccine and reduce their anxiety because I see a lot of like I know when I got my vaccine, like I saw a lot of people that were like highly anxious and then they kind of like look this way or look that way and they were like, oh, it's over. You know what I mean? They didn't even know they got stuck with the needle. So I think like a lot of this, again, a lot of the fear is just tied more to the anxiety than the pain. You know, that's just my guess. So I think distraction is kind of, you know, that would be the that would be the best method I would go. But what did you think of kind of the methods they was offering? And what were you surprised by them? And which ones did you think were most or like least effective?
Like I thought the whole, and it's funny how you think what's a contributing factor, and it makes perfect sense, but you don't think because it's so simple, right? You don't
Right.
think that a fear of needles is something that would be a contributing factor, but it is. And, you know, based in the fear of needles is thinking, or usually with any type of fear or anxiety, it's thinking like, okay, whatever is going to be taking place is going to be too overwhelming for me to experience. So
Right.
even that needle, you're thinking that it's that pain, even though it may be short, is going to be so insufferable, and that's what drives your anxiety up, right? You're thinking all these other different, all these fear-based thoughts that are coming into that's driving your anxiety. And yeah, this was a really interesting article. As I was able to do a little bit more research, and then they said a study in 2019 found that 16% of adults avoided getting the flu shot due to their
Oh wow.
fear of needles, right? And that included people that work in hospitals, that work in long-term care facilities and other healthcare facilities. So these are, different officials, nurses, all these other clinicians that are actually, that work in that field, but they're like, nah, I'm not getting it because, again, of their fear of needles. And so, yeah, you had to think, and you know how it's interesting too that they've been coming up with all these other different methods, right, of trying to get people to get the vaccine, right? They've been having all these other different incentives like beer, you're getting like baseball and basketball, like sporting event tickets, lottery tickets, all these other different things, and these incentives just to, have people participate and incentivize it. However,
Yo,
you still have people with the fear needed. They're like, nah, I'm not doing it.
it,
Like,
and not even to go off on a tangent, but like I saw so many crazy giveaways. I saw them giving away shotguns. They were giving away joints. Like
yeah,
in Colorado, they're giving away weed.
yeah,
It's crazy. Like to go get a shot, lottery tickets, everything.
yeah. I was upset because listen, I'm like, man, I should have waited.
Right. Give me a lottery ticket or
Yeah,
something, right?
I could have gotten some, some Phillies tickets or some Sixers,
Yeah.
I'm like,
Budweiser's they're giving out beer. It's just crazy,
the incentives. I'm like, man, I should have waited. See, shame on me for being, compliant and trying to be on save on early and stuff. See, I should have went the other route. But this is a real thing, right?
Right.
This is a real thing. It's anxiety and the symptoms that are associated with any type of fear are some of the things that could be mild to severe. Like you mentioned, when you were, getting your vaccine, you saw some of those reactions, right? You saw people, looking around hyper vigilant. They're probably, even if they're not showing those physical symptoms or expressions, like a lot of people who would, if it's severe, people faint when they have fear needle. People
Right.
have the heavy breathing. The blood pressure is high. It's escalating. The heart rate, and then of course what we're experiencing or witnessing is avoidance. So what I did like, as far as the solutions, is distraction. I feel like distraction is absolutely one of the best. I think bringing a friend or a relative would be really helpful. So if you're there with somebody, I think it's kind of the combination, like you said, you're distracted with talking to someone, and then also you have that support, right? We've always talked about that, having that sense of community. Being on your phone, while you're doing it,
Right.
be IG, Facebook, like read a post, start tweeting something. I also thought about music. I mean, one thing that you also see so many people walk around with, we got our pods or our buds in our ear. So,
Hmm.
if you're sitting there and you're listening to your music while it's getting ready to take place, I feel like that's a good distraction and that would be, really helpful. So, but yeah, this is a real thing. I think long term, yeah, absolutely. They mentioned therapy, which I feel like, yeah, it would be helpful. I think, especially if it is impacting any area as far as your health, if it is a situation where it's impacting and having an effect where you're not just a vaccine, but you're not going to the doctor, period, or you're avoiding certain things. Like, absolutely, you want to have this addressed because this anxiety can manifest and it can continue to get worse if you don't, have
I
it cover addressed.
like when they were, talking about the methods. Of course, I already said I thought distraction would be one of the most effective. Pain reduction, I kind of had at number two.
Mhm.
Uh, they were kind of talking about, I think, like putting a cold pack up there, and some patients were talking about that kind of helped in terms of lessening the pain. I honestly had psychotherapy at the least effective, right? I do think it's necessary if it's affecting like medical, like adherence,
Right.
like if we're talking about going to doctor's appointments, um, and you're not doing certain things that's gonna be detrimental to your health. But it's like, listen, man, most likely it will be some sort of like exposure type of thing,
Right.
combined with psychoeducation, of course. And I'm not trying to make light of it, but to me, like, and this is just my humble opinion, but exposure therapy will work very well with a lot of things. You know what I mean?
Mm.
But when you're talking about certain things, it's like it's a very controlled environment, in a therapy session. You know what I mean? And it might work for some people, but for the person who thinks about like a needle as like I'm getting stabbed like that, it may not be as effective. That's why I put psychotherapy third,
Mm.
but again, I kind of think like if it's to the point where it's affecting like you going to doctor's appointments and all of those things, it's probably going to be affecting you in other places. You know what I mean? It's not going to be just a little issue. So, you know, um, I kind of have mixed feelings about it, but
I did
that's
have the if I'm ranking them, I'm putting the plan really as number one because I feel like the plan is gonna overlap into like the distraction. So
right.
say for me, knowing that I've gotten the flu shot because I've worked at the hospitals and it was mandatory, so I just kind of went along with it, and I didn't have like any type of like religious or culture type of reservations associated. So I'm just like, all right, whatever, it's mandatory, I'm gonna get it. But
Right.
what I did do, as far as with the flu shot or even the COVID vaccine, is that I'm aware that it's gonna come, like your arm is gonna be sore. So it was more of like having a plan that I had. One, all right, let me take some meds before I get it. Right, let me take some Tylenol, some Aleve, or something prior to getting it, so that would reduce the pain. I also maybe did it since I was getting at work. I probably did it towards the end of the day because I know at times some people, or I've gotten it earlier in the day, then by the end of the day, your arm is a little sore. and I didn't want to go
Right.
through work for the rest of the day. So my plan was, all right, get some meds, also get it towards the end of the day. So by the time I get home, if there is any type of pain symptoms, then I can lay down, I can chill. So I like that idea of if you are going to get a vaccine, whether you have a fear of needles or not, but absolutely, if it is, this is the case, it's definitely having a plan because like you can already kind of prepare for what's going to take place, the pain reduction aspect of what distraction technique you're going to use, whether it's going to be music, what you're going to do on your phone, whether you're going to take somebody. Like I like the idea of having a plan and going into it, so this way you're more prepared. And then, so I rank that at number one, and it'll overlap into the other ones.
No, I mean, listen, I agree. That doesn't, that sounds good to me. I mean, again, I think it's definitely an interesting article, but I'm thinking that, that's a subject that's not kind of talked about enough,
Yeah, yeah, you're right. So yeah, that was pretty cool. You know, thinking of other different things that you typically don't think about, right? So I don't know about for you. However, when I think of occupations that are associated with burnout, I immediately usually associate burnout, occupations with anything medical, right? So especially this day and age, especially over the past year, you think about nursing, right? You think about nursing burnout just because of what nurses and other people that have been working in ERs and what they've had to experience and what they've been seeing day in and day out for the past year or so. I also think about our field, of course. I think about therapist burnout. I think about clinician burnout because of what we hear every day. All the demands and emotional toll it can take on you. I think of our field. However, came across an article where, surprisingly enough, you're talking about attorneys. All right. So again, for me, and this might just be my ignorance, but I never really thought about burnout or kind of looking at the struggles of attorneys. So a recent study came out, and data reveals the startling mental health struggles of anxiety or mental health struggles for attorneys of color. Let me just pull out these figures right here. Yeah. So it says, notably, 31% of Black lawyers said that they have contemplated suicide during their legal career. This is a significant increase from the approximately 23% from Hispanic or Latino attorneys, 20% of Asian attorneys, and almost 19.4 of white attorneys who have reported the same tendencies. So this talked about, the data reveals just how differently the workplace stressors and the pandemic have impacted mental health attorneys. So reading through this article, what was your takeaway from this, Jack?
I thought it was interesting, right? Like, again, I wasn't really expecting it. I thought it was interesting, number one, that all the people of color kind of in the survey reported increased stress compared to, everyone else. Um, I was surprised, right? Because the assumption immediately that I would make is that, like, working remotely, they would have less stress, right? Um, but that's, again, my ignorance, because I'm not an attorney, right? And they were just kind of talking about time, right? Like not being able to separate kind of the office from home, everything kind of running as one long day, you know, people expecting, since you work from home, for you to be getting things out all times of the night. So I can understand that. I what was most interesting to me about this article was, like, as I was thinking about it, I was like, well, I wonder where, like, their stress is coming from, like, primarily.
Mhm.
And in addition to some of those things I said, like, those were kind of like general things that they were all saying,
Right.
but they were like, the minority related stress was the important thing, right? Like, they were saying, feeling like taking time off for mental health could hurt their career, right? And that kind of hit home for me, because that's that internal pressure of being, for lack of it, well, being in a position where, we're one of one, or we are the minority, and you're either an attorney, or you're in a position where it's just not a lot of people that look like you.
Right.
And I know I've kind of experienced that as an intern, as a grad student, where it's like you feel like you can't say no because it's going to reflect badly on you, you know.
Remember
So
them days.
that's kind of when it hit home, you
Mhm.
know, when it was talking about taking time off for my mental health could negatively affect my career, you know. It, again, that's what hit home because I remember when, you know, being in that position where you feel like you can't say no. So what did you think?
Um, Again, like you said, like not as in tune to attorneys or in that legal realm. And this is not to say that they don't do work, because we all know, you know, attorneys, lawyers is I can only imagine what how long their day is. But I think sometimes, you know, for me, you only think about, okay, you know, of course the courtroom, and then also other different legal proceedings, a lot of paperwork and things. Um, the part that stood out for me, and I'm also going to throw some more numbers out there in a minute, was that one of the a black woman attorney, who was the president of the Black Women's Lawyers Association of Greater Chicago, she mentioned that one of the stressors that they're not being promoted, and they're
Okay.
not being given meaningful work, right? And then she said it just boils down to just not feeling like you're truly wanted there, and just like you're feeling like a quota. So, you know, you're feeling like, all right, well, I'm just here, right? So in addition to feeling isolated from everyone else, because you're still working within COVID, because there's still litigation taking place, there's still legal proceedings, all these different things.
Mhm.
So, you know, you're feeling another system of isolation from your own firm, right? You're being looked at, they're not giving you meaningful work. So, I mean, what does that do to your self-esteem? What does that do to, you know, your self-confidence?
And I mean,
You know?
it's to me, it's logical that feelings of like isolation or not feeling valued, undervalued, can directly lead to you having thoughts that, oh, if I take off, you know,
Yeah.
then it's going to negatively affect again my ability to either their perception of me or my ability to move up or all of these things, right? I don't know, man. It's crazy. I think, you know, a lot of times like we see people who are in, you know, certain positions, and you just don't know what a lot of people are going through, man. You
Yeah,
know, but I think a lot of, especially, I don't want to just say professionals, because there's a lot of um positions, jobs that people of color can be minorities in that aren't necessarily, you know, being a doctor or a lawyer. You know what I mean? There's a lot of, I mean, if you look at like classically trained singers who are African American, you know what I mean? If you look at classic dance, outside of Alvin Ailey in the 90s, you know what I mean? There wasn't a lot of black folks doing those things that in the arts, different places. So all I'm saying is they're one of ones or minorities in terms of in these positions and all over, whether it's art, sciences, all over. And I think we're all kind of going through those things in different ways, you know. Because again, when you're already isolated and you already feel like there's a magnifying glass on you, you know, it's hard to pull back and say, well, listen, I can't take any more on right now. Like it's hard to say that. Like, you know, I'm just used to over the years just closing my door and silently screaming, right? Or just wait until the day is over and venting to my family members on the way home, you know. But in terms of saying no, you never say no,
yeah,
you know.
yeah. And it is
Um,
something, because the respondents in this article said that in addition to the isolation and the lockdown, they said the work related stressors were higher than their fear of catching the virus.
right,
So they
right.
said, yeah, we got the virus that's taking place. There's concern about that, but my stress is more work related.
Oh yeah,
You
oh
know,
yeah.
and then, you know, they mentioned also that 51% of Black attorneys, and 49% of Asian attorneys, and 49% of Hispanic attorneys, they said that their firms don't offer support for personal well-being. So not only are we going to put that magnifying glass on you,
Right.
we're not even going to offer you that mental health or that emotional support that this job, you know, is accustomed to or is associated with. So what do you do? And I can only imagine also another layer is it, like there are certain occupations and certain jobs that when you do reach out and you do talk to people, maybe family members or friends, that okay, there are some jobs that are kind of somewhat universal when you're talking about the stress, where we're talking about like sales or maybe other different things. You know, being a lawyer or attorney is, I don't think, doesn't fit in that category because it's a very specialized, occupation. So you're not
Right.
going to have a lot of people that are going to understand the demands that come with outside of maybe other attorneys or other people in that field. So
Absolutely.
that could be an additional layer of isolation that you feel like people don't understand. And I can only imagine, again, because there's so much litigation, there's so many things that people, that lawyers and attorneys work in these different realms, that it's ongoing, right? So it's continuous, like this avalanche of work and other different stress and clients, like you said, are mentioned. Just because you're working from home, they're probably maybe even more demanding that they're experiencing, and then you don't get that support from your institution. Like, unfortunately, how it's become bigger and it's become less stigmatized in a lot of other different industries, and they're willing to offer support. They just said in half of this, half of these folks here are saying that no, there's no support coming from our employers.
I mean, the thing is, I think things are starting to change a little bit, just because, you know, they're starting to shine a light on more, more of the detrimental effects of ignoring mental health, right?
Mhm.
Like I've seen a lot of articles lately about the changes in the culture on Wall Street, and this is kind of, to me, an extension of that, because we're kind of talking about professions where in the past it's similar to the warrior kind of mentality with the athletes. It's like you work until you die. These are the professions, right? You work long, you don't sleep if you want to get ahead, or you want to be partner, or you want to be this person, that person. Um, and I think changing this tone, like it kind of starts in terms of an organizational level at the top, right? In terms of value and mental health. So that's going to start with, talking about it, making the environment safe to talk about mental health, and then putting your money where your mouth is, right? Bringing in programs or giving your staff access to programs, for stress, anxiety relief, those things, yoga, gym memberships. And, you start to see some corporations in the last couple of years starting to try to do those things. I think if one good thing could come out of this pandemic, is going to be that a lot of other organizations that kind of haven't thought about mental health are going to have to, think about ways that they can, give their employees exposure to, some positive mental health habits, through coping or through psychoeducation, whatever it is.
You're right, because what you don't want, like you mentioned, it's work to the death. Because there were a few industries like Wall Street where they started to become more active in protecting the mental health well-being of their employees when more suicides started to take place. And that's what you don't
Right.
want. You don't want it to be a situation where you're, becoming reactive, because so many people have gotten to that point. And we already talked about, said almost half, of the respondents, especially those people of color, were saying, "Hey, I've thought about it. I've
Right.
thought about it." Right. So you don't want that number to get high, because somewhere in that, unfortunately, will be someone that attempts, and that's what we don't want. So I'm hoping that, with COVID, that shines a light and that highlights, the need for it. So, something to continue to monitor. So I hope it goes in trends in the right direction.
And just to kind of cap it off, just as a bigger issue, man, it's just reiterates again just how race, has permeated almost every angle of our society, right? Because regular stressors are compounded by our race. This
Mhm.
is what, people need to understand, right? Whether we're talking about white people or just, the general public, or even black people who aren't educated as to why certain individuals, continue to fight in terms of like injustice, right? Because the pandemic is stressful enough, right? Being a lawyer is stressful enough. But if you're a black lawyer, right, we have evidence that, that stress is compounded, right? So little things, right? This is little things. Driving is stressful enough, right?
Yeah.
You got people that don't know where they're going. You might be lost. Driving while black is even more stressful.
I'm a wild black, a whole other level.
You know what I'm saying? So I think like people have to understand like this when people of color push these issues, whether it's Dr. Seuss, whether it's, this company or that company, and they think that we're just pushing little issues, is because this is not a uniform, right?
Mm-hmm.
We wear this all day, every day, right? And everything that we do, imagine if where you go eat, your race impacts that. You go buy a car, it impacts that. You go to drive that car, it impacts that. If you're in Beverly Hills, even if you got a lot of money, you try to get in a Fendi store, it impacts that. Didn't the lady not want to show Oprah a Birkin bag?
Yeah, yeah.
So that's why again, like, and I don't mean to go off on this tangent, but I'm thinking like, man, like attorneys, they under enough stress as it is. And you got a 10% increase in people experiencing suicidal ideation, and I'm just the fact, like, race is in America, it is almost always going to be a factor.
It runs
It's
deep.
almost always going to be a factor.
It runs absolutely deep. Staying with people of color. So I came across an article, and a young lady shared her experience while she was in college. So I'm gonna lead it off. So while in college, a group of women approached me and asked me what I scored on my SATs. Now, in that moment, I knew that what they were questioning, whether I belong in college or I had gotten here in some kind of diversity program. And she said it instantly triggered her imposter syndrome, right? And it also showed how systemic racism can reinforce it. And though anyone can experience it, imposter syndrome affects us Black and Brown people in specific ways. And for those people that aren't aware of what imposter syndrome is, it's a phenomenon in which, like she said, any person can experience it, but especially if you're highly skilled or highly credentialed person, and you have that fear of being exposed or being looked at as a fraud. And so, despite how many credentials or accolades and accomplishments you have, it affects the best of us, and you're worried that your performance on a task or your performance in the working field or environment will be exposed, and your deficiency will be out for general consumption. So with this, what she talked about was how, again, that imposter syndrome affects us differently, and I think we touched a little bit on it, in the previous article we just talked about. But what were your thoughts about this, Jeff?
I mean, again, this impacts us, specifically because it gets to the core of like our identity, right?
Mm-hmm.
And I just think it's obviously a very important topic in terms of us culturally, because again, and it's personal for me, because whenever we talk about this, it's usually always connected in some way to education or intelligence. You understand? So, and I can't ever help but be insulted, so we've touched on this before, but again, not surprised that it's gonna that it occurs in higher education settings, in a lot of the places it does occur. But again, we got to get rid of, the stereotype that, you know, um, that we have an inverse relationship between, intelligence and blackness. Like, we got to get rid of that. We got to get away from that, and the problem is, and I'm not going to dump on any particular genre of entertainment or anything like that, or sports, anything like that. But the problem is we reinforce it in so many other ways. You know what I mean? But again, especially when you talk about this girl, the environment that this occurred, you know, it, it's incredibly salient to us as people of color, because whenever you talk about imposter syndrome, inevitably is always attached to, our intelligence, right? And we're never gonna get out of our own way. Again, I'm gonna always say this: if we tell our kids to go to school and do the best they can, right, and then we reinforce being stupid as cool, and being stupid as being salient to our identity, right? And being cerebral as being salient to white identity, right? As long as we continue to do that, then we're going to be caught in this cycle, right? We're going to wonder why we can't get out of our own way. we're going to tell our kids to work hard, and then we're going to wonder why we look at them, and some of them and some of their behaviors are the opposite, right? Because everything that we're reinforcing and a lot of the things around them, reinforce opposite values, unfortunately.
Yeah, I
So,
mean, anytime that where you pigeonhole your own self or someone that looks like you, it's counterintuitive, right? Because we're already, if you're saying that, well, only, you're only going to be able to do certain things, and if you do, it's because of a different external factor, or, like you said, it's not cool. You need to be operating on this type of level, because now you're fighting two battles, right? For someone, that's trying to move up, that's trying to has certain goals. Like now it's an uphill battle, not only against people that look like you, but then against, you're also fighting against systemic oppression and racism. And it's like you're constantly in that mode of you have to prove yourself, just like what she's talking about. Right now, you're going to have outside people. You're going to have maybe, people in the majority, white people, whatever, however you want to describe it. And they're going to look at you like, okay, like they asked this young lady, are you only here from, because of affirmative action? Right? Are you
right,
only here due to these other external factors? And now, you start to believe that. So you're already fighting the systemic oppression and racism that doesn't want you to be there and feels like you only got here because of some type of quota, because of some type of loophole or whatever type of situation. And so then you got others that look at you and saying, hey man, why are you trying so hard? And why are you, in this situation, it's not cool for you to be smart, for you to obtain these different things. So yeah, it's like if you're accomplishing these goals, you're doing it in spite of these things. Right. And like
right,
you said, this is where that syndrome looks a lot different because you're getting it, unfortunately, from both ends. And
right.
so this takes a toll. You really have to have yourself and be able to convince yourself and say, you know what, I'm not an imposter. Like, we feel just on a daily basis or at times when, we have a difficult patient or some of the results or people have setbacks. And so
Hmm.
getting that additional layer or reinforcement from our own folks or from those from the systemic issue, is difficult and it could really take its toll.
I and honestly, on a bigger level, I'm just speaking in terms of like us as African Americans or Black people, individuals from the African diaspora, whatever you want to call it, right? Like we lose a lot, and I don't think we understand how much we lose, right? Because again, it's like there's a lot of people who are not, for lack, whatever you want to call, who are not in this fight right now, right? Because they feel isolated and they feel like they don't fit, right? Because we can't say that there's more than one type of Black person, right? More than one type of Black experience. So you got people who feel like they're too educated to participate in these discussions, right? Because they're going to be rejected, right? And we lose a lot because there's people that feel like they can't fit and they have something to contribute, whether that be through connections, whether that be through their point of view, whether that be through whatever. But we are losing a lot because, the and obviously this is anecdotal at this point because I don't have statistics to back this up, but what you see is, a lot of divide and conquer, by socioeconomic status,
Mhm.
by geographical location, suburbs versus city, by culture, right? West Indian, African American, African. You see a lot of divide and conquer, right? Because you see people that don't think they fit, right, in the larger conversation when they really do have other things to contribute. Because the reality is, in all of our worlds, all of our families, we all have professional and unprofessional, blue collar, white collar people, all in our families, all in our communities, all in our neighborhoods, right? But so to create the image, or to put out the perception, that in that in inner cities or in the suburbs or wherever, they're not professional people and blue collar people all mixed up, together, it's just false, right? And again, it there's a lot of people, unfortunately, sitting on the sidelines right now. I know some of them, who could contribute a lot, but they just feel like they don't fit, and that's our own fault.
That's that crabs in a barrel mentality, and all it does as a result is limit opportunities, right? You're limiting your own or other people's opportunities who could, like you mentioned, contribute in a vast major way. However, like you said, if you're going to pigeonhole yourself, or you're going to, put limitations or restrictions on others and say, well, you can only do this and you should do that, and separate these experiences, then, um, I mean, it's just so counterproductive to us moving forward. And it's, you don't see that in other, other cultures. You don't see that in other races where you're pulling each other, or you're poking at people's, their coattails and saying you can't do something. And again, we already have a system that's already in place that's saying that you don't belong. And the
Right.
only reason why you're here is because of some type of system or some type of loophole. So this is where, again, that imposter syndrome, it's, like I said, it's compounded by things that we've told ourselves are intergenerational, issues.
Yeah.
So, but yeah, this was a really decent article, and it highlighted some of the things that we've discussed, and other little small doses in other different areas. So, but I'm happy to say the young lady who wrote this article and shared her story in the beginning of it went on to become a psychologist. So
Okay.
you know what that resilience looks like. She's part of the psych family.
That's what's up. That's
Yeah,
what's
it is.
up.
All right.
All right. So moving right along, this last article is I just kind of want to look at the concept. So before we introduce this, what we're saying is we're just looking at this as a concept, right? So this is in Psychology Today. It's talking about the search for happiness. So there's a British psychologist, Dr. Robert Holden. He wrote a book, 2011, and he coined the phrase destination addiction, right? And the reason why I said in the beginning we're looking at a concept is because it's not a real addiction. Okay, so the concept of destination addiction is a preoccupation with the idea that happiness is in the next place, or happiness is in the next job, or with the next partner. And until you give up the idea that happiness is somewhere else, it'll never be where you are, right? And just some of the points he was making is just individuals who kind of get caught up with this view, they're blocked from their successes, and they kind of have the belief that the future is where happiness is, and the goal is kind of to get through the day and not to enjoy the day. So one thing he was saying is that you're kind of this type of person if you're always in a hurry, even when you have nowhere to be. You always promise that next year you'll be next busy. Your dream home is always the next home you want to buy. You don't like your job, but yet you have good job prospects there.
Mhm.
You never fully commit to anything in case something better comes along. And you think you should be further ahead than you are, and you have so many projections that you never get anywhere, right? So what do you think of this concept? Do you know anybody that might be impacted by this? What'd you think?
I think the concept is can be applied to a lot of us, because for the reason that a lot of us tend to have, we're always thinking ahead, right? We have that analytical mind that's always thinking what we're doing next. Even as we're engaging in a task, you're thinking about next week, you're thinking about next year, you're thinking about prospects, you're thinking about all these other different things. And it's difficult for anyone to be happy if you're not in the present moment. If you're constantly thinking about, okay, how can I get to the next one? How are you even thinking about, okay, your job or whatever endeavor you're involved in, your relationship or other different things? How can you enjoy what's happening now? Like, even in
Right.
relationship wise, it's like, you know what, I want my relationship to get to this. I want us to communicate more. Why don't we communicate more? And if you're in a situation and you're completely not thinking about how you're communicating now, then of course, yeah, the relationship is going to be, it's a higher probability that it's going to fail, because you've been wanting for this to happen. You weren't even thinking about what was taking place currently. So I feel like that's absolutely what takes place, where people aren't able to find that happiness, because you're not thinking about what's taking place in front of you, right? You're losing that sense of mindfulness of being in the present moment, and you're just thinking about, okay, what else is going to make me happy, like you said, the next job, all these other different things. So yeah, I agree with that concept, because it is a form of an addiction, because it's like, you got this, what's next? What's next?
I kind of in terms of the relationship, I kind of immediately thought of the 80-20 kind of rule, like just
Okay.
in terms
Hey,
of
Tyler Perry, I see you on this. You know what I mean?
yeah, man, just kind of in terms of not valuing what you got, right? And kind
Mhm.
of looking grass is greener syndrome, kind of, for lack of a better term,
Yeah.
kind of looking at like, yeah, I got just about everything I want at home, but I see something that that I like, right? That's what I kind of looked at in terms of relationships, like people that, they could be in a relationship with somebody that, they care about, and they, of course, all relationships have problems, and the problems they probably have could probably be worked through with some good communication, but they might get distracted, right? By somebody that might not even be as good of a fit. But
Mhm.
so in terms of the relationship, I was kind of thinking of that. Or you just have these people that are like serial relationship hoppers, so maybe they fit in that bucket somewhere. But I was also thinking like of us as grad students, right? Because I don't know about you, but when I was in my master's program, like I was like, all right, when I get out my master's program, I'm going to my doctoral program. After my doctoral program, I want to open up a practice, and then think about us in our program, right?
Mhm.
And I wrote this down, the most common phrase I have heard from every student. I know you're not going to guess it, but I'm going to give you 5 seconds to guess it. From everybody in our cohort, you said it, everybody said it at least 20 times, 20 times a term. I'm going to give you 10 seconds.
What? Private practice? That joint?
No, a phrase that we all said, like something we all said at least 20 times every semester.
No.
I
Mhm.
can't wait to get this over with.
Oh yeah. Oh yeah. Okay. Yeah.
Or I
Yeah.
can't wait to the end of the
Yeah.
semester.
Yeah. You're right. Yeah. Yeah.
It's almost the definition of this, right?
Yeah. Can't wait.
Because,
Can't wait for this shit to be over.
right, that's what we were saying, right? So it's like, and what we're doing is because we're trying to get from August to Christmas break, right? You
Yeah.
know,
In a hurry too.
or just looking at it another way, us going from PCOM, right, to internship to postdoctoral to, so it's very easy, especially like you, if you're a medical student and you go from college, you're thinking about studying for the MCAT and then and then you get into medical school and then residency. It's very easy to lose 8 years.
Yeah.
You can lose 8 years just just studying and to pass tests and going here and there and just not in, kind of enjoying. Like I, for one, like I say this and it's a little bit exaggerated, but the best Big Mac I ever had was the day after we graduated. It was the best one I ever had, the best smash burger I ever had, the best piece of chicken I ever had, because of the simple fact that I felt like I could finally rest.
Mm-hmm.
So
Yeah, our minds. Yeah, we weren't. There wasn't that. What's next up, right? It wasn't
right,
like, okay, I already got this. Now I'm working towards these other hours. Like you're in practicum, or like we started the program. Now we're working towards practicum. Once we got a practicum, now we're working towards internship. Once we're working towards internship, it was like once you graduated, it was like, all right, there's nothing really left, right? Other than like your
right.
postdoc or in licensure, it's just like, all right, like you said, you can breathe because our minds are always in that looking at the final destination. But
Right.
if you're looking at that final destination and that's all you're looking at, you didn't forgot about what you saw along the way.
And
Right?
that's why I think,
You're not even enjoying the car ride.
and when you bring up mindfulness, it's like we on the same page because I wrote that down as, just it was for lack of a better term, but I put like treatment, right?
Mhm.
Mindfulness, right? Only because this is what you want people to do, right? Enjoy the ride, right? Yeah, you might have that stressful day in medical school where you're running from this place to that place, but I know you've always seen those people on PCOM campus, right? Like we'll be hustling and bustling, running, and then you'll see somebody sitting on the grass, eating lunch, like relaxing,
I
maybe for
remember,
5-10 minutes or whatever, but it just looked like they sitting on a cloud, enjoying the moment. you
It
know?
took. I always wonder what are they doing. I'm like, is that med school?
Right.
I'm like, when do they get time to sit on the damn grass? I'm sitting here like, I want to sit on the grass, And you're right, man. It took a long time for me to get to that point, even like later in the program, after kind of learning about mindfulness of just kind of
Right.
slowing down and, because again, even when we would go on our breaks, right, to go get something to eat or heat up our food, you're still thinking like, all right, we got this class. This Jones 10:30, man. The class ends at 10:30, 10:15. When are we the presentation that we got to do during the second half of the class, right? You're thinking about all these other different things and thinking about practicum or work the next day. And, you look up, you're at the end. Now what? And did you enjoy yourself? Like you said, the quality, right? You're always thinking about all these different accolades or things you're trying to accomplish. And you think that that's going to bring you happiness, right? If you accomplish this, all these other different things, you get the relationship looking for like you said, the 80-20 and having your relationship either be perfect or find someone that's perfect. And then you miss, like you said, what you have in front of you. Or you would miss the whole thing that was taking place or the ride there, right? You forgot that how you even got there. You were there now.
And that brings me to the next point, because what he was saying was, he said that, the impact of it is that it leaves you like psychologically absent, right? Because you disregard what you have, feeling empty. And it says the trouble with destination addiction is that it focuses purely on finishes and not on purpose, right? To live intelligently is to live with purpose, to make the means the end and also the end the means, right? The end is in every moment. And it's real. Like I thought, that's why I kind of thought this was interesting, because this is me at a lot of periods in my life, man. It was me for about 10 years trying to catch up to whatever I felt like I needed to catch up to. You know what I'm saying? And I just have times that are just a blur. I can remember tests I took better than like what significant like memories are at that time. You know what I mean? So
Totally,
just
man.
a interesting thing to think about. You know what I
Yeah,
mean?
it's a lot of people experience that. I know I have. And then you get to that point that now what, right? Once you've accomplished that, now what? You have these
Right.
accolades, you got to the end, and because, like you said, it was an addiction, it was something that you were preoccupied with. And
Right.
now that you're here, how was it getting here? Do you even remember it? That's something, really quick. When people ask me about like parenting, and I'm not gonna, proclaim to be this great parenting expert, but something I always ask people when they're just like, oh, well, your kid's at a certain age, and they're like, oh, I can't wait for high school, my kid to graduate, and I'm just like, listen, enjoy it right now,
Right.
because it's really true to form that it goes by like that, like
Right.
seeing your kid grow and develop. Sometimes people are so focused on, oh, well, I can't wait until their first day of kindergarten, or they're this all these milestones that people think of.
Right.
But the road, now enjoy where you're at and be present as much as possible, because one, like you were just saying, whether it's school or parenting or whatever, you don't get that time back.
Right.
You
And
know.
then also, we don't know the nature of how life is. Listen, there's a lot of people, that are unemployed today that, probably had job security in 2019, respectfully. You know what I mean? So we don't know how life is going to turn out. So mindfulness to me, is one of the most important things I've learned, right? Because it's one of those like I'll give you like personal example. Like it's just like my mother always used to be like, yo, give me my flowers while I'm here. But to me, it's the same perception that you have in mindfulness. You know what I'm saying? It's the present moment. So enjoy me here, enjoy me now, right? And
Mhm.
enjoy this conversation that I'm having, right? Enjoy this sunshine, enjoy that movie or that ice cream, right? Because for all we know, a challenge could be waiting right around the corner. It could be hours away, you know.
Absolutely.
So to me, that's another way that we kind of insulate and preserve our mental health and practice good habits, is to practice mindfulness on a regular basis, right? And that could be as simple as gratitude once a day, right? Um, or sitting outside and eating that meal. But either way, you know, I think it's a way to practice good mental health habits and kind of insulate ourselves from stress at the same time.
Yeah, absolutely. Just kind of stopping and taking in the moment and breathing. Um, and just existing in the moment. And then also what I'll add really to that is also balance, right? Not putting everything, like you said, within that one venture. Like you said, a lot of people, you're straightforward, you want to accomplish whatever this feat is, and you think that's going to bring you happiness at the end goal. But like you said, there are so many other different things that you didn't remember along the way because you were so focused. So absolutely incorporating some other different areas of your life, and that's where I believe happiness comes with that balance of all these other different things that you're interested in. But yeah, it was a great concept, and I'm totally in agreement with all of it. So you know
Sure.
anything else before we get out of here, Jay?
No, man, I got nothing else, man. The Nets are playing, so I'm gonna check that out,
Yeah, yeah, the Slim Reaper. Let's go check this guy out.
Oh yeah. But before we get out of here, of course, want to thank everybody for listening. We definitely appreciate it. If everybody who has, shared the videos, there's been a lot of people doing that, so we appreciate all the likes, comments, and shares, especially. And please keep subscribing. We really appreciate it and definitely humbled by the support.
Absolutely, guys. So, yeah, I echo everything that Jay said. We appreciate the support, the feedback, the comments. We enjoy interacting with you guys. Jay and I are both very active on whether it be YouTube or the social media. Interacting your ideas. So don't be shy. Keep passing them forward. And keep watching and listening. We appreciate it, guys. So we're on everything. And that email again is the Black Psychologist Podcast at gmail.com.
Oh yeah, send the video questions. Send the video questions.
That's it. We're gonna make you famous. We just made this other person famous. Listen, so this is what we're doing. We're about uplifting and propelling people into a different stratosphere of popularity. Okay, so let's get it.
All right, no
All
doubt.
right, all right, Dr. J. Until next time.
All right, bro.
All right.